Now we get to talk about another will I say material or substance that is usually used in all those contrast imaging. So it's usually abbreviated as what, 99 MTC HDP, but the full name is what is known as the technetium labeled hydroxymethylene diphosphate. Okay, so when you give it to a patient and you image, it makes it possible for you to visualize some areas that wouldn't have been so visible, but because you have administered this, it actually makes you visualize them better. You understand? So this is another image that is used. Okay, so you give it and it helps you to look at some particular structures better. So the technetium labeled hydroxymethylene diphosphonate, okay, that's a 99 MTC, okay, HDP. So it's a widely used radiopharmaceutical, okay, in nuclear medicine, and they usually use it for bone scintigraphy, all those bone scans. So it allows visualization of bone metabolism and pathology. It can help you see how a bone is actually, growing and all of that, and it can also help you to be able to look at if there is a bone disease condition like all those osteomyelitis. So chemical nature is actually a diphosphonate compound. It binds to bone mineral. Okay, so it's tagged with technetium 99M. That's a gamma emitting radionuclide. So it's the one that will actually emit some 1 or 2 waves that the radio, that's what you're actually using for imaging, can be able to grab those waves and convert them to the images. So mechanisms: after injection, it accumulates in areas that have a lot of active bone turnover. That's osteoblastic activity. Do you understand? So that's what to able to help you pick it up. So clinical use is used in all those bone scans for all those bone cancers, to diagnose fractures, to assess osteomyelitis, to monitor arthritis and other inflammatory conditions, to dictate avascular necrosis. Do you understand? Bone infarction. You understand? Advantages is very accurate. Okay, so once there's an abnormality, to always help you pick it. So imaging characteristics is normal distribution, so symmetric uptake in skeletal, kidneys and bladder. Okay, abnormal uptake, this is where you now see focal or hot spots. It indicates that there's now increased bone activity. Do you understand? If you see focal places, see, focal places are dark. These other places are taking it normal. But for the dark places, say that there's an increased activities around that region. Cold spots are areas of reduced uptake, meaning indicate that maybe blood supply is not even reaching that side of the bone. So that's what we got.